I'm Taylor Prewitt. This is Tim Nutt. He will introduce himself in due course. And Mary and I want to thank you all, both of us want to thank you all for coming out. It's just wonderful to see old friends, and we just really appreciate so much the opportunity to see you and to share with you. Mary's high school class is here, a number of them, because they heard that Mary's husband had written a book. So they're very loyally turned out for that. And Tim Nutt is, tell us your exact title.
I am director of the UAMS Historical Research Center, which is the archives unit of UAMS.
Right. He is the medical historian of Arkansas.
Yeah.
And Tim, I'm grateful to Tim for working with Wordsworth to get this set up, and thank you very much. And let me defer to you for further formalities and to carry on.
Okay, thank you. I just have a few things that I need to say. Mainly just to thank Wordsworth and Lynn Phillips and Wordsworth Books for hosting this tonight, and for all of you for being here. Really, really appreciate it, and thank you, Dr. Prewitt, for coming over from Fort Smith. This event is sponsored by the Society for the History of Medicine and Health Professions, which is an organization that supports the mission of the UAMS Historical Research Center. And they do that by giving us money, which we always like, and to purchase materials from our collection, books for our History of Medicine collection, and also materials and artifacts for our archival collection. But then they also sponsor events like this to educate Arkansans about the history of medicine in Arkansas. A lot of people don't know that Arkansas has a rich history from the health sciences and medicine, and so they try to do that. And we have, one of the things they do is programs like this, but then also the first Thursday of every month from 12 to 1, they host a Zoom program called the Stay at Home Lecture. It was started during the pandemic, and it's a 1-hour lecture, and we have various topics on the history of medicine. So next month, for example, I will be the presenter, and I will be talking about Dr. Neil Compton from Northwest Arkansas. So if you're interested in that, feel free to talk to myself or Suzanne Easley over there, raising her hand behind you, or Jeffrey Stark. There are two of my colleagues at the Historical Research Center, and they'll be able to give you a little bit more information if you're interested in that. I hope you'll consider joining the society. There are some membership forms over by the refreshments. We won't withhold the refreshments if you don't pick up a form. But I hope you'll consider joining. The membership dues are quite inexpensive, $15 for individual and $25 for family. If your friends, if you have friends who weren't able to attend tonight, it is being recorded, and it will be uploaded to the Society's YouTube channel. And if you had such a great time tonight and you want to listen to it again, you're more than welcome to go to the YouTube channel as well. So we're going to have just a sit-down conversation, Dr. Prewitt and I, and I'm going to ask him some questions, and hopefully he'll give me some good answers. But also, if you have some if you have the questions, some questions that you want to ask, please feel free to raise your hand. You do not have to wait until the very end to do that. So we're just going to pretend like we're having a conversation, and you're going to tell me a little bit about the book, a little bit about some of the events and the topics that you address in the book. So are you ready to go?
Ready to go.
Okay. Y'all ready to go?
Yeah.
Okay. So before we talk about your book, tell me how you got into medicine. Was there a pivotal event in your life that attracted you to go into the medical field?
Well, I grew up in McGee, Arkansas, and I remember walking around the Greystone Hotel where the senior men of the town would gather, and I heard them talking about so-and-so had been to see a heart specialist. And so I thought, well, the heart must be pretty important if they're going to see heart specialists. And so that kind of got me tilted in that in that direction.
your microphone, Tyler.
Okay. I went to the University of Arkansas without a clear idea of what I wanted to do. I knew I did not want to farm, and I wanted to find a place with air conditioning if I could, which was just barely invented at that time. After a year and a half at the University of Arkansas, I'd taken some courses in chemistry and biology, and I discovered that I could really do that. I guess I'd not been sure that I could really do that, but after getting through 3 semesters and so on, I decided, well, I think I can do this. And so why not, if I can do that, I may as well go into pre-med and be a doctor. And I was thinking of being a country doctor, small town doctor at that time. I thought, well, if I'm going to do that, maybe I'll just major in something that I enjoy also. So I decided I would major in English because I had done the high school newspaper in high school. And so anyway, I wound up with a major in English, getting my pre-med, and going on to Washington University Medical School and training in Chapel Hill, North Carolina, and coming back to Fort Smith.
And after you came back to Arkansas, you ended up at the Cooper Clinic in Fort Smith.
I had a friend in Fort Smith named Ben Cabell, who was a couple of years older than I was, and at that time I was stationed in Memphis in the Public Health Service, and I called Ben and asked him if anybody needed a doctor in Fort Smith or any such thing. And he said, well, I'm not sure I can think of it. And I said, well, my friend Jerry Stewart mentioned Cooper Clinic. Oh, yes, Cooper Clinic, yes. And so about five or 10 minutes later, the manager of Cooper Clinic called me, and so I went over, and my friend Jerry Stewart, who was also in Memphis at that time, and I went to Fort Smith, joined Cooper Clinic, and got started with that. That's been great fun, yes.
And you must have liked it because you stayed there for a long time.
Well, it really is pretty unusual. Not very many folks start out in practice in one place, stay in the same town, the same practice, and then retire from it at some approximation of retirement age. And so I did that, and I think maybe I don't know why, but I loved being where I was, and inertia, I just stayed.
Well, how in your busy schedule as a doctor, tell us how you got into writing this book, and tell us what this book is about, how before it got complicated.
Okay. Well, I had retired. I retired at age 65 in 2003, and a few years later, a friend asked me if I would make a talk at the Clayton House on a Sunday afternoon as part of a series of Fort Smith history programs. If I would make a talk on the history of medicine in Fort Smith. And so I said I would be glad to, but then I decided I'd better find out something about the history of medicine in Fort Smith. So I did enough research for that, and I wound up with enough material that I put it in the Journal of the Arkansas Medical Society, and later in the Journal of the Fort Smith Historical Society. And so that got me started on that, and then Billy Higgins at the Historical Society helped me by putting in basically an article a year for several years about this, that, and the other, but they formed the backbone of this book before it got complicated.
Now, tell us how the title came about, though. What does "Before It Got Complicated" mean?
Right. Well, things did get complicated, and the event that I chose to use as the date at which it all became complicated was August 10th, 1975, when President Gerald Ford came to Fort Smith to dedicate the new St. Edward Mercy Medical Center. St. Edward and Sparks, the two major hospitals, had both been located downtown, not very far from each other, but in 1975, St. Edward built a new hospital out on 74th Street, way on the east part of town, which separated the two hospitals. The two clinics were similarly separated by that time. And so, of course, you know, it wasn't that the bell rang on that day at noon or anything like that, but I chose that as an arbitrary date for the time at which things began to get complicated. You all know as well as I do the things that have made medicine complicated in recent years with third-party payers, with insurance, with a lot of doctors, with clinics, with yakety yak and so on and so on. In Fort Smith, I think one thing in particular that made it complicated was that at about that time, more and more doctors started coming in. And when that happened, why, and actually two of those who came early in about that time are here. That's Doug Smith and Anthony Bennett, at least those two. And I'm delighted to see them here. Anyway, as the town grew and the medical community grew, I didn't know all the doctors anymore, and I call that complicated. So I took it up in 1975, and anything after 1975 was just too magnolia for me to congeal.
Too complicated for you to write a book about.
Right.
Well, one of the topics you talk about in the book is the influenza pandemic of 1918,
Right.
which was obviously a watershed moment for all of Arkansas and the world. How did the pandemic affect Fort Smith and the surrounding areas, and what did the cities and towns do in the reaction to the flu pandemic? Well,
It was really a horrible thing. In October of 1918, if you look at a mortality plot, in October, whoop, it goes way up, and then November, it comes right back down. The flu pandemic came in surges, but this particular surge came like a prairie fire and blew through the town, took a number of lives, and blew out. One of the things I tried to do was figure out or find out, well, how many people died? How many people got it? How many people died? What happened? So I started looking for the records, and I think that was when I called Tim, among other things, and said, where are these records, you know? And basically what I got was that they were burned up, or they're lost, they're gone, we can't find them. And so what I did was to go through the microfilm of the newspapers in October 1918, and that would have things like 5 died yesterday, and they would say, epidemic on the wane, 5 deaths yesterday. The curious thing was that everybody insisted, and particularly in the papers, that this was no big deal. A few people were dying, yeah, but the war was just coming to an end, and on the front page, and I can tell you, looking at the front page of any Fort Smith newspaper, 95% of it was about the Kaiser and the war and everything, and way down in the corner, it might be about flu in Fort Smith, quarantine in October, and that was about it. So I just got anecdotal accounts. You could count up 117 deaths, but who could say how many deaths there were? Because people came from outside. You know, a family of 8 got on the train in Sallisaw, Oklahoma, and 7 of them had flu, and they came into Fort Smith, and 1 or 2 of them died. And you know, where are the numbers on that? So you don't really know. Little Rock really had a harder time with the epidemic than Fort Smith did, because Little Rock was right next to Camp Pike. Camp Pike caught the first flu deaths, and before the authorities slapped a quarantine on the whole state, the flu had already galloped through Little Rock, and it had just sort of begun to get a foothold in Fort Smith. So when the quarantine hit, not that many people had died in Fort Smith, but of course they escaped the quarantine. The flu escaped the quarantine anyway.
And they, you know, the official numbers for flu deaths in 1918 was, I think, around 7,000
Yes.
people statewide, which is, I think, way under under the real total
Right.
of the deaths. Mainly because, and one of the reasons why the black community did not report the deaths. They did not have access to medical care as the white community did, and so a lot of the deaths that were in the black community just weren't reported. And then some people, some of the deaths were probably from the flu, but they were not identified as dying from the flu. So there's just all these reasons why that the numbers are so low in the flu with flu deaths. So we have any questions from the audience?
Yeah.
Yes, sir.
Treating the flu back in those days, I'm sure you researched that, and I kind of think I know what it is. But compared to then as now, how has the treatment of that disease evolved over time?
Let me repeat the question for those who may not have heard. So the treatment of the flu in 1918, the treatments has evolved. What's the treatment of the flu then, or what was the treatment of the flu then versus how they treat it now?
Well, I have a slide that my friend Sam Taggart gave me showing about 5 different bottles, morphine, this, that, and the other, that were used to treat the flu. None of them worked. At least we do have some anti-flu medications now, but then we had none. And the doctors worked hard, went around, did all that they could, which was nothing. Many of them got flu. Several of them died. Those were pretty well documented. But what they really, the thing that helped most was nursing care. And people wanted nurses if they could get them. Anybody who would come and play the role of a nurse in lieu of that. And so a number of heroic people did that. Several of them, of course, also got the flu. But the only thing that worked was quarantine. And it's interesting that one place in Arkansas did not have any flu, and that was the tuberculosis sanatorium in Booneville. And the tuberculosis sanatorium was a self-contained unit unto itself. Nobody in, nobody out, and they had no cases of flu.
We have another question from the audience. Yeah, Dr. Pate.
Dr. Bird, thank you very much for the book. I enjoyed hearing it. Practicing in the southern city, Fort Smith, at the time you did, what were some of your top 3 challenges that you faced every day?
Yes. So practicing in a southern city and during your career, what are the top 3 challenges that you faced in your career?
Oh, that's a very good question. What were the 3 challenges? One challenge is getting help. When I got to Fort Smith, and when Anthony came and when Doug came, we were pretty much overrun by patients, and we're trying to find help. And one of my little stories is, I won't go into too many stories, but there are a lot of stories about trying to attract physicians to come to Arkansas. And so that was one challenge. Let's see. I suppose it was a challenge was that Fort Smith at that time, was not an academic medicine place. It is now. But it was not like practicing where you had residents to take care of the patients in the hospital for you. People had heart attacks in the middle of the night, just like they had babies in the middle of the night, and the doctor had to be there for both of them. And and it wasn't called a resident; it was put on your pants. So that was a challenge. What would be another challenge? Those are 2 that occur to me right at the present time.
One more thing. What would you tell a young graduating 4th-year medical student? What advice would you give them?
What advice would I give 4th-year medical
Yes,
students?
what advice would you give to a fourth-year medical student?
Well, I think one thing is to tell a fourth-year medical student that you've just started to learn about what medicine is all about, and it's going to change. And so, you know, try to use your brain and use your head and figure it out for yourself when you can. Get help when you need it, but continue to learn throughout your years. You know, it's not that you have your little kit that you can go out with, and of course I would say don't just depend on the algorithm, but try to figure it out for yourself.
The first hospital in Fort Smith was established in 1887.
Yes.
Before Little Rock got a hospital. And it has an interesting story of how it got started.
Yes. In 1887, a railroad man in Fort Smith had an infection in his leg, which became so bad that it had to be amputated. And there were plenty of doctors who were ready to operate on him, but there was no place for the operation to take place because surgery was done in the kitchen in those days, in the home. And this man was an itinerant railroad worker, and he had no kitchen, no home. Reverend George Dagan at the St. John's Episcopal Church found out about this and located a vacant building on 11th Street in Fort Smith. Got some of the ladies in the church to fix it up, raised enough money to acquire the building, but in any event, very quickly they had this place fixed up so that the amputation could take place, and it was. So since George Dagan at St. John's Episcopal had done the work on it, they called it St. John's Hospital, and so that was the first hospital in Fort Smith, and it developed on through some complicated name switches and so on from there on.
And it eventually became Sparks, right?
In addition to Sparks. Yes, it became Sparks. St. John's joined with another hospital, was called Bell Point. In 1908, George Sparks was on the board of Bell Point Hospital and made a $25,000 gift and said he wanted to name it in memory of his wife, Elizabeth Liza Dibbrell Sparks. And so he did not name it for her first name or any of that. He called it Sparks. So it was named for his wife, and it was called Sparks. So that became Sparks Hospital, which kept that name until, well, Anthony and I talked about that when it changed hands, but it's now Baptist.
And of course, Dibbrell and Sparks, both of those family names are pretty prominent in medical
Yes,
history.
I'm guilty of a little name dropping there because, as Tim knows, Mrs. Sparks was the daughter of Dr. James Dibbrell, and his son, Dr. James Dibbrell Jr., moved to Little Rock, where he became one of the 8 founders of the University of Arkansas Medical School.
One of the other topics you discuss in the book is about a particular doctor, Dr. A.M. Borland.
Yes.
And he was known for his archaeological collection or find. So would you tell us a little bit about him and his archaeological find?
Yes, I will. Actually, I guess it's irrelevant to this, but in 1973, I was driving down Jenny Lind Street, and I saw a sign that said books for sale. So I wheeled in and asked if they had any medical books. Yes, there's some over here. And so I pretty quickly spotted one that was the first edition of Osler's textbook of medicine. And so I thought, well, you know, that thing, that's a rare find. So I asked, how much is this book? Oh, we sell them by the inch. That's 5 inches, that'll be 2.5 inches, that'll be $5. I said, oh, well, thank you very much. And the inscription on it was Borland with a flowing handwritten script. Well, somehow I bumped into the story of a mastodon being found, the bones of a mastodon being found on the banks of the Arkansas River, which could have been not too far down the hill from my own house back in 1885, I believe it was, written up in the New York Times. We have a clipping from the New York Times about this antediluvian monster that was, the bones were found, and it was in the possession of Dr. Borland, who had the lower jawbone of this monster. And Dr. Borland was the father of the one whose book I purchased. Dr. Borland had the largest collection of geological specimens in the state, it was said. He also had various fossils and so on. And of course, one might ask, where are they now? And nobody knows. You know, you'd think there'd be a museum that would have all that, but that would be in a perfect world, and this is not quite that. Dr. Borland, I've seen a picture of him, and I've printed that in the book, with looking straight ahead, eyes surrounded by white, looking straight ahead out into the great unknown. You'd think he was an Old Testament prophet with long white hair and wild eyes and so on. He actually, he learned medicine before Civil War by following a doctor around for 2 years, and then he served in the Civil War, mostly as a surgeon, sometimes fighting. After the war, came to Van Buren, and he had many interests. He had a library of books in French. He taught Greek and French lessons in his home. He was just had many interests, and died at an old age in Van Buren, revered as a much more saintly fellow in his old age than he appeared to have been in his younger days.
It is. I sure wish we would know what happened to those mastodon bones.
That mastodon, we have no idea. There's no shortage of mastodons remains in Arkansas, which has probably more mastodon skeleton remains than most any other southern state. And I went over to Jonesboro, and Sally, there she is, and I went to the museum at Arkansas State where they have a complete mastodon skeleton. And so Sally Prewitt has 1 or 2 pictures in this book.
That's right.
Sally Prewitt Morris, sorry about that.
Well, that's okay.
2 of the other people that you discuss in your book are pioneering physicians in Fort Smith, Dr. Harry McDonald and Dr. Roger Boast. Would you tell us about them and what makes them so integral to the growth of medicine in Fort Smith?
Well, Harry McDonald and Roger Boast are 2 little-known heroes in my estimation. Actually, Roger Boast is probably pretty well known in Little Rock. He's known in Fort Smith because of the Boast Child Care Development Center, which he started. Roger Boast was born in Clarksville, and he came to Fort Smith where he practiced pediatrics from about 1956 to 66. During that time, he was an advocate for care of children with disabilities, and pounded the pavement in Garrison Avenue in Fort Smith raising money to get something started to take care of children with disabilities. It started with 6 children in the basement of the Methodist Church, and now the Boast Center has stations practically all over the state where young people have become middle-aged and even older people with disabilities, and they still stay with the Boast Center finding employment. Roger Boast was an inspirational fellow. After 10 years in Fort Smith, he came to Little Rock. He joined Dale Bumpers in setting up the Department of Human Health Services, I'm a little wrong on that, and was a consistent advocate throughout his life of better pediatric care. His obituary in the Arkansas Democrat Gazette said that he was probably had a greater influence on extending health care than anybody else in Arkansas. Harry McDonald is probably not well known, but Harry McDonald was the only black physician in Fort Smith. In 1966, he led the NAACP in suing the Fort Smith School Board to allow black children to go to the Fort Smith schools. And that case, his suit was denied until the Supreme Court got it. U.S. Supreme Court, in a decision 5-4, upheld the NAACP and said the schools are to be fully integrated now. So Harry McDonald continued to be an advocate. He was born in South Carolina. He was born to what you might call an upper middle class black family there. His grandfather served in the South Carolina legislature during Reconstruction. And one of his cousins was the personal doctor to Martin Luther King, as Harry was reminded when he had a letter from Coretta King saying that, you know, my husband was taken care of by your cousin. But Harry continued to be practically the only black doctor in Fort Smith. He was, he integrated the Sebastian County Medical Society, became president of the Sebastian County Medical Society, and was just a wonderful person. He was, he could not get elected to the Board of Education in Fort Smith because they packed the House to vote against him, but Bill Clinton took care of that. He put Harry on the State Board of Education, and Harry repaid the favor by getting Bill Clinton into the NAACP, so that when Bill was nominated for president, he could say that for 19 years he had been a member of the NAACP. And shortly before Harry died, his daughter arranged for Bill Clinton to make a phone call to Harry, and we actually have a recording of that, which is illegal because you're not supposed to record an ex-president's phone call. But Bill Clinton was at his best, and we all know what he can do on the telephone or in a one-to-one conversation. He says, "Why, you picked me up when I was nobody from nowhere with nobody and nothing, and you made me a member of the NAACP so that when I ran for president I could say I'd been in for 19 years. So Harry was a charismatic fellow. He personally integrated, sometimes at gunpoint, the swimming pool, movie theaters, you name it, in Fort Smith. He was a great friend, and it was a great privilege in my life to have known him. So it was a great honor for me to write about Harry McDonald.
There have been a lot of many impressive physicians and people that came out of Fort Smith that impacted the medical community in Fort Smith. And coming from 1887, when St. John's Hospital was formed, and thinking about the evolution of medicine in Fort Smith, what do you think were the key factors in the development of medicine in Fort Smith and the Arkansas River Valley?
I've thought about this actually since completing the book, and I think the two figures who were pivotal in establishing Fort Smith as a medical center were St. Cloud Cooper and Fred Kroc. St. Cloud Cooper came to Fort Smith in 1895. The story is that he was on a train passing through Fort Smith, changed trains, was walking through town. At 13th Street in Garrison, he saw a horse and buggy making the turn. It turned out that was Robert Meek, whose family later owned the still owns the Coca-Cola company in Fort Smith. But Robert Meek was a member of the Gentlemen's Riding Club, smartly turned out, horse pacing very smartly, had a whip in hand, very impressive sight. And so St. Cloud Cooper said, if this town is good enough for somebody like that, it's good enough for me. And so that's a legend, of course, but he came to Fort Smith and practiced, and he did make it a point to go and introduce himself to Robert Meek and tell him that story. But in 1920, St. Cloud Cooper organized Cooper Clinic. He had served in the World War I and become impressed with the advantages of organization of medical care, and he and 3 younger colleagues in Fort Smith made a pilgrimage to Rochester, Minnesota to visit the Mayo Clinic, which had only gotten the name of Mayo Clinic in 1914, so it was not the mega institution it is now. But he and his 3 colleagues decided that they wanted to set up a group practice in Fort Smith along the same lines, and they did. And it was, we have the minutes going all back to the first board meeting, and all their papers that were drawn up, and it shows the percentages that each physician was to draw. They did not all draw equally, but they all drew a percentage. It was not just who you had seen. So that established a pattern for an organization in medical care. About 6 months later, Charles Holt formed a similar group, which was the Holt Clinic. It was not a partnership. It was just simply you work for Dr. Holt, and he paid you $300 a month, and you worked for him. He did bring in Fred Kroc. Fred Kroc in 1927 had trained in OBGYN at Johns Hopkins under Howard Kelly, who was the father of OBGYN in this country. Unfortunately, or for better or for worse, jobs in or positions in OBGYN were not easy to find, and Fred Kroc had advertised for help, and Fred Kroc answered Charles Holt's advertisement, came down. What Charles Holt needed was a surgeon, and so Fred Kroc scrubbed with him, and he became certified in surgery soon after. He also did x-rays because he had done x-rays as a moonlighting thing in his training and so on, did pathology. But what he really did was to recruit doctors to come to Fort Smith. And the classic story on that is John Olson, who was the head of surgery at Holt Kroc, and Swede Olson grew up in North Dakota, trained in New York and Philadelphia, married a Philadelphia heiress of the Philadelphia main line, but he answered an ad from Fred Kroc, from Charles Holt, who was asking for a Mayo-trained surgeon, not just any surgeon. He wanted a Mayo-trained surgeon. Swede Olson could check that box, and so he went down. And the story is that he called his wife Clemmy and told her that he was in Fort Smith looking at a practice there. Fort Smith, where's that? It's in Arkansas. Arkansas, where's that? It's in the South. The South. Do they have palm trees? So, in any event, Fred Kroc brought in specialists in pathology, in urology, in radiology. He got Ernie Mendelsohn from New York, and Ernie Mendelsohn was a German Jew who attended University of Berlin, got out, I don't know how, in the late 30s, made it to New York, and Fred Kroc found him and brought him to Fort Smith to be the first radiologist. He did this because a few years after Fred Kroc came to Fort Smith, he told Charles Holt that he had to leave because he was still making $300 a month. it wasn't enough. He needed more money, and he was sorry, but he'd have to leave. But Charles Holt negotiated with him, and he said, we will call it the Holt Croc Clinic, and we will make it a partnership. And so with that, Holt Croc became a partnership. And Fred Croc was a brilliant fellow, almost like Dr. Borland, except he didn't collect mastodons. But he did collect doctors, and he brought in help, doctors from not just the neighborhood, although he did get some of those, but from all over the country. And that established, I think, Fort Smith with a nucleus of talent.
Wow, what a great story. So my last question to you, after writing the book, do you have a favorite story? What's your favorite story related to the history of medicine in the Arkansas River Valley?
Oh, I've already told two of them. My favorites were about Robert Meek and his horse and buggy attracting St. Cloud Cupper, and the other was John Olson calling his wife. I'll just tell one quick story about Harry McDonald getting the lunch counters integrated in Fort Smith. There are two versions of the story. I'll kind of combine the two of them. But back in the, I believe it was the early 60s, was when the lunch counter sit-ins began across the country. And Jerome Nye owned the Boston store. The Boston store was actually was sprung from the same family of Stix, Bear, and Fuller in St. Louis. Boston store was the place to shop in Fort Smith, and the Boston store tea room was where you could have, the ladies would have tea, or whoever, you know, and it's very, very nice. So Harry and Jerome Nye had worked together actually on the mayor's council to work toward integration in Fort Smith, so that they were pretty much on the same page. But the Boston store tea room was segregated, and so Harry went to the Boston store, and well, one of the versions of the story is that he bumped into, he asked for Mr. Nye, and Mr. Nye came out, but it was Jerome Nye's son, Randy Nye. And Randy said, "Oh, Dr. McDonald, my dad's out, and this is my first day at work. Would you mind coming back and integrating the tea room on another day?" And actually, I printed that story in the Historical Society, and I got a call a short time, not long after that, by Randy Nye, who said, "Taylor, nobody's going to care about this except me and you, but I want to tell you how it really happened because I was there." And I said, "Okay." And he said he came in, and he and Harry McDonald went up to see his dad, and Harry sat down and he said, "You know, I've been shopping at this store, and my wife has for 15 years. "Yes, sir, we know that." "I buy all my Hickey Freeman suits here." "Yes, sir, we know that." "My wife gets her Judith Lieber belts here." "Yes, sir, we know that. But I can't eat in the Boston tea room. Can there something we can do about that?" And so Jerome Nye said, "Yes, we will. You bring your wife to the Boston tea room tomorrow or whenever you can at 3:30 in the afternoon, and you'll be served. Our employees and our customers need to get accustomed to this. So a couple of weeks later, y'all come at about 1:30 in the afternoon. You'll be served. And then a couple of weeks after that, come at noon. My wife and I will join you for lunch, and we will have lunch in the tea room." And so they agreed, and there was no sit-in, and that was the way the store was integrated. Jerome Nye, by the way, was invited some years later to join Hardscrabble Country Club. He was Jewish, and that was unprecedented. And he said, "I will join Hardscrabble when a black man is invited to join." Harry had gone by then, but a black man was found and joined Hardscrabble, and so did Jerome Nutt.
Wow. Do we have any questions from the audience? We have time for a couple of questions. Yes.
I came in late, you may have already addressed this issue. My understanding is that the Fort Smith doctors were the leaders in medicine for some time during the 20th century. Did you address that in the book?
Fort Smith doctors were the leaders in medicine in the 20th century, and Jim wants to know if you addressed that in the book.
Yeah, it was a talented group, and I appreciate you saying that, yeah.
And I'm sorry, the medical society was located in Fort Smith, was it not?
The medical society was located in Fort Smith?
Actually, it was. The editor of the Journal of the Arkansas Medical Society was Bill Brookshire. And he was the editor from maybe 1936 to 56, something in that range. And so during that time, for convenience, the offices were located in Fort Smith.
Thank you.
The question, yes.
Thank you for the book. It's wonderful. Would you share a little bit about the change in healthcare delivery from house calls? You talk about this a little bit in the book, to more of the emergency department setting, and how Fort Smith handled that, because you're covering such a huge territory beyond the city itself as a practicing physician, and how you saw that change over the years and how the medical society or medical establishment supported that.
Unending compliments about the book.
I'm sorry.
Unending compliments about the book. But she would like to know about the sort of the, and correct me if I get this wrong, about the sort of the development of medicine from country doctor to emergency room doctor, the development of that in Fort Smith.
Well, a few little comments. The two clinics worked hand in glove with the two hospitals, and as it was laid out, Sparks and Holt Crock worked together more, and St. Edward and Cooper Clinic worked together more. This was not a formal arrangement by any means, and back in the 70s I would have maybe 60-40 patients at one and the other. And when I arrived in 1970, I would take call at each hospital emergency room in a rotation with other doctors on the staff. And I would get a call in the night from Agnes Lochner, who was the ER nurse at St. Edward. And she would say that she had a patient there, thus and such and so, and I needed to come see him. And so if Agnes Lochner told me I needed to come and see the patient, I went and saw the patient. She basically ran the emergency room, was the triage, she was the nurse, and she called the doctors to come in. It wasn't long after that before the hospitals began to hire sometimes superannuated physicians who were looking for something to do besides a regular practice, and so they took emergency room work. And by the 70s, the ERs had, well, by the 80s, I guess, the hospitals had ER physicians on site to take care of them, and they would call the doctors in, et cetera, et cetera. So that's how that developed. Of course, one thing that happened with the delivery of health care was that both clinics disappeared. Holt Crock was bought and sold 3 times, I think, by various managed care organizations before it was absorbed into Baptist Hospital, which had acquired Sparks. And Cooper Clinic lasted from 1920 to 2017, when it merged with Mercy. And, you know, a merger is basically, it changed its name. The name came down. I have a photograph of seeing the COO being taken down and the Mercy Tower being put in place. That was the day that it officially took place. So, you know, what I said in finishing the book was a line taken from the movie Grand Hotel. You know, the movie Grand Hotel, where the desk clerk stands there, Grand Hotel, people come, people go, nothing ever happens. You know, and in Fort Smith, you know, clinics are born and clinics die. Hospitals change their names. A new osteopathic college is formed. People come, people go, nothing ever happens.
Well, Dr. Prewitt, thank you very much for being here. We really enjoyed this, and you'll be around to sign books for people afterwards. And thank you all for coming. And I think we still have some books left, right?
We do. We have 2 left for now.
You have 2
But
books left.
if we sell these out and you need more, we'll just order them for you.
Okay, thank you all for coming.